Imagine a massive, high-tech water purification plant. It hums 24 hours a day, filtering millions of gallons to keep a city safe and functional. Your kidneys are that exact same facility, but for your body. Their primary job is to continuously draw in your blood, pull out the waste and excess fluid to flush away as urine, and send the clean, balanced blood back into circulation. But what happens if that plant suddenly breaks down? The output of clean fluids sputters to a halt, and toxic waste immediately piles up. Doctors call this sudden, massive drop in filtering power acute kidney injury, or AKI. To get the system back online, we have to look at 3 specific points along the pipeline to find the breakdown. The first place to check is the inbound supply line leading right up to the plant. This is a pre-renal failure. Think of this as a problem at the front door. The filtration machinery inside the plant is in perfect working order, but the blood it needs to function has stopped arriving. In the human body, this supply drought happens when the overall pressure in the system drops. Whether from severe dehydration, massive bleeding from an injury, or a sudden heart failure, these can all choke off the blood supply before it ever reaches the kidney. This is a chart showing the overall breakdown of these cases. This inbound supply failure is the most common issue we see, making up about half of all acute kidney injuries. Because the kidney's internal hardware isn't physically broken, it can bounce back quickly. Once we restore the blood flow, usually by giving fluids through a drip or treating the heart, the system often returns to normal. Now, let's say the blood supply is flowing perfectly fine. The second place to look is right in the heart of the facility. This is an intrinsic injury, structural damage to the filtering tubes inside the organ itself. Toxins, harsh medications, or infections can physically fracture these tube walls. Additionally, if starved of blood, the lack of fresh oxygen causes this internal machinery to shrivel and die. This type of damage can't be fixed instantly. Because the hardware is physically broken, the kidney needs time and medical support to slowly rebuild itself. The final place to look is the outbound exit pipe. We check here if the blood supply is fine and the internal machinery is functioning perfectly. This is a post-renal failure. This happens further down the line, where a physical backup is preventing anything from leaving the building. When the fluid hits a blockage, pressure builds backward. That intense reverse pressure travels all the way back into the kidney, crushing the system. In a patient, this outbound blockage is usually a mechanical obstacle, like a kidney stone wedged in a tube, a tumor, or an enlarged prostate. In this scenario, the kidney is a victim of a downstream traffic jam. Once the drain is physically unclogged, the pressure drops, and the kidney can resume its normal work. Here we see the 3 distinct failures side by side: a dry incoming pipe, a broken internal filter, and a plugged outbound drain. Despite these very different causes, they all lead to the same deadly result: a filtration rate plunging towards 0. When a patient arrives with failing kidneys, doctors use this supply, facility, or drain framework as a checklist to isolate the exact point of the breakdown. Recovery depends on matching the treatment to the specific location of the breakdown, whether that means clearing a blockage or supporting the hardware while it heals. By looking at acute kidney injury as a solvable plumbing problem, doctors have a clear, reliable roadmap to get the entire system back online and save the patient's life.